One of the biggest issues I see in borderline personality disorder is impulsivity. This can look like self-harm, unsafe sex, binge eating, drug or alcohol abuse, reckless driving, lashing out at others, and making rash decisions to cut people out of your life, just to name a few of the most common impulsive behaviors people with BPD often struggle with. People with borderline usually engage in these destructive behaviors as a way to cope with really big, uncomfortable emotions or as a way to cope with stress in relationships. And these types of destructive coping skills will work really quickly and offer you immediate relief. That's why it's so easy to keep turning to these behaviors over and over again. The problem is, these types of impulsive behaviors usually make your problems worse in the long run. You feel better in the moment, but afterward, you're left to deal with the fallout of your decisions, and you start having problems in your relationships because people don't want to deal with your volatility. Furthermore, whatever distressing situation you were dealing with when you got dysregulated, that situation is probably still there waiting for you, only now the situation is even worse. If this pattern feels familiar to you, I want to encourage you to practice self-compassion. You're not engaging in these destructive behaviors because you're a horrible person or because you want to harm the people around you. You just need some additional skills that you can use in the moment when you're in crisis so that you don't keep turning to the destructive behaviors that offer you quick relief but make your problems worse in the long run. My name is Ramsay Dean, and I'm a licensed therapist, and most of my experience has been working with adults with serious mental illness. If you're new here, welcome. In today's video, I'm going to teach you one skill from Dialectical Behavior Therapy, or DBT, that can help you manage your impulse control. This skill I'm going to teach you today is called the STOP skill, and it's what's called a distress tolerance skill. Distress tolerance skills are designed to help you get through crisis moments without using destructive coping skills and making your problems worse. So stick around if you want to learn about the STOP skill and how you can use it to curb impulsivity. All right, so let's talk about the STOP skill. Now, STOP is an acronym. If you are new to learning DBT skills, DBT loves acronyms. There's a ton of them in the treatment. Now, STOP stands for stop, take a step back, observe, and proceed mindfully. Okay, let's talk more about the S, which stands for stop. Anytime that you notice you're starting to have big emotions, you start feeling dysregulated, or you feel the urge to do something destructive, you need to stop. This means literally stop what you are doing. If you're about to send a nasty text message, stop typing, put the phone down. If you're about to open the fridge and look for something to binge eat, stop moving. Don't touch the fridge. If you're about to self-harm, don't move a muscle. Stay perfectly still. If you're talking or arguing with another person, zip your mouth and be quiet. Now, this might sound easy, but it's actually really hard. There can be all sorts of reasons why we don't want to stop. Maybe we've gained too much momentum and we're already too emotional, or we've already started the destructive behavior and we say, screw it, it's too late to turn back now. Or maybe we are just in the middle of something and it's inconvenient to stop. Whatever the reason is, if you can just freeze for a moment, a lot of times this is enough to put some space between our emotions and our behavior. Let me explain what I mean. A lot of times we fuse our emotions and our behaviors together as if they are one and the same. We feel angry, we yell at someone. We feel depressed, we isolate and stay in bed. We feel lonely, we look for somebody to hook up with. There's this 1-2 punch, I like to call it, of feeling and then action. If you can muster up the willpower to just stop what you are doing when you're having a big emotion, a lot of times this is enough for us to come to our senses and not allow our emotions to dictate our behavior. We want to create some physical space between what we are feeling and how we are behaving, and that's what the S in the STOP skill is all about. All right, let's talk about the T, which stands for take a step back. So once we have stopped what we are doing, we've given ourselves a pause and we've created space between our emotions and our behavior. Now we need to create space between ourselves and whatever situation we are in. If you're arguing with someone, leave the room. Say you have to use the bathroom. Do whatever you need to do to get away from the person for a minute. If you're driving, find a place to safely pull over if you can. If you're thinking about self-harming, get yourself away from any sharps or weapons or excess medications. Now, if you can't take a physical step back for whatever reason, then take a mental one. Stop thinking about the situation for a moment moment and turn your mind to something else entirely. Think of something that you know either brings you joy or distracts you. For me, I like to hum or sing, but you've got to find what works for you. Once you've taken a step back, now I want you to take a few moments and do some deep breathing. Try taking a few slow, deep breaths. This is going to help you regulate your emotions and turn down the heat just a little bit so that you can think more clearly. If breathing exercises don't generally work for you, then do something else that does. You could try progressive muscle relaxation, you could try grounding techniques, anything that is going to help bring you back to the present moment and help cool down your emotions. If you guys are interested in mindfulness techniques and emotion regulation strategies, let me know in the comments down below. I don't have time to get into it in this video, but I could certainly make some videos on that in the future if you are interested. Okay, so once you've stopped what you were doing and taken a step back, the next step is to observe what's going on both inside of you and around you. First, I want you to observe what's going on inside of your body. Make note of everything you're feeling. Do your shoulders feel tense? Is your heart racing? Is your stomach in knots? Do you feel burning hot? Are you shaky? Notice any physical sensations you're having. Also, observe what emotions you are feeling. Are you angry? Are you lonely, sad, embarrassed, confused? Next, observe your thoughts. What kind of thoughts are you having? Are your thoughts overly negative? Are your thoughts distorted? Are they black and white? Are you jumping to conclusions? Are you trying to mind read other people? If you're not familiar with the concept of cognitive distortion, so things like black and white thinking, mind reading, emotional reasoning, etc., I did a whole video on that topic you can check out if you want to learn more about that. But pay attention to and observe your thoughts. Once you've done that, observe what is going on around you. If there are people nearby, what are they saying? What are they doing? How are they behaving? What might be their point of view of the situation? I also want you to observe your physical surroundings. If you're inside, what's going on in the room? What kind of decor is on the walls? Just observe and make note of everything. Think of yourself like a really good detective investigating a crime. Good detectives want to collect as much information, as much data as possible about the event in question, even if it doesn't seem important. They're not gonna be jumping to conclusions right away. They're gathering as much information as they can at first before they start to narrow their investigation. Once you've observed everything both internally and externally, then I want you to ask yourself, how did I get here? And as you answer this question, I want you to be non-judgmental and I want you to stick to facts, not opinions. So for example, this might look like, I didn't sleep well last night. I had a few of my friends not respond to my text messages, which triggered my fear of abandonment, and I didn't have time to eat lunch today. Now it's the evening, I'm more vulnerable to my emotions, and I'm feeling the urge to lash out at my partner because they don't want to watch television with me, and I'm perceiving that as rejection, and I'm feeling emotionally out of control. See how I am not putting myself down for having big emotions in this example? I'm simply observing the facts of the situation and making note of everything happening and leading up to this moment so I can gain some perspective on where are these impulsive feelings coming from. Once you've observed your situation and gathered all the facts, the P in STOP stands for proceed mindfully. And this is where the rubber meets the road. It's where you intentionally decide, what behavior am I going to choose in this moment? I can choose to follow my impulses, proceed with what my emotions are telling me to do, and probably make my situation worse, or I can choose to engage in a behavior that is going to get me closer to my goals, closer to my values, might require me, unfortunately, to sit in my uncomfortable emotions for a bit, but is ultimately going to have a better outcome for me and the people around me in this situation. Now, sometimes, especially as you practice and get more comfortable with the STOP skill, how to proceed mindfully might be obvious. Don't yell at that person. Have a conversation. Take space. Reach out to a support person, engage in a pleasurable activity, etc. But sometimes, especially when you are new to practicing the STOP skill, the right answer might not feel so obvious, or you might still be so revved up emotionally that you still really want to do the impulsive thing anyways, and you're not successfully getting that distance between your emotions and your actions or your behaviors. If this happens, there's a couple of things you could try. You can start the skill over again from the beginning, so stop, take a step back, observe, and do it as many times as it takes until it feels possible to proceed mindfully. Keep in mind that this takes practice. There is no shame shame in needing to do this several times before it feels like it's working for you. There's also a couple of questions you can ask yourself and process through to help you proceed mindfully. What are your goals for the situation? What are you hoping to accomplish, and what is the most effective way to reach those goals? Now, make sure when you are thinking about your goals that you are focusing on what is within your control. Do not set yourself up to fail by trying to control other people's behavior or external factors that are not within your immediate control. You can also ask yourself, will reacting impulsively really get you what you want in the long run? Or what will you think/feel about this tomorrow if you choose the impulsive behavior? Once you have carefully considered all of this, then go ahead and proceed mindfully. Move forward in a way that is going to help you in the long term, even if that means managing some internal discomfort for now. Thank you so much for watching this video. I'd love to hear from you in the comments. Let me know what questions you have. Are you interested in more videos about DBT skills? Because the stop skill is just one of many skills that DBT can teach you to regulate your emotions, tolerate hard things without having meltdowns, and maintain quality relationships. And on that note, I will catch you in the next one. Take care. Bye-bye.